talking there. How can I talk? Look at that noise there. No. Good morning, fellow Namibians. COVID-19 continues to be a grave public health threat to our country. Despite some reprieve, we cannot afford to let our collective and individual guards down. However, the last 31 days have offered our country and communities some respite. The country has now recorded a cumulative number of 126,341 confirmed COVID-19 cases. Of this, 96% have recovered and 2.7% of cases lost their lives. During the period under review, the death rate declined by 85% nationally. However, the case fatality ratio in Omaheke region remains high at 6.3%, which is 2 times the national case fatality rates. These numbers represent lives of mothers, fathers, wives, husbands, children, spiritual, traditional, business, public, and community leaders and members. Our country has lost some of its best brains, productive citizens, and nation builders. We have also lost and continue to lose a generation of elders who possess cultural and indigenous knowledge and wisdom. A vacuum has been left by COVID-19, which we must all now endeavor to fill. The positivity ratio has declined from 28% to 10%. The regions which recorded the highest reduction in new infections are Kavango East by 91%, Zambezi by 87%, Thomas by 82%, and Erongo region with a 78% drop in new cases, respectively. This notable descent on the incidence curve must remain everyone's priority and responsibility. We must all work together in order to suppress further transmission of the virus in our country. Testing continues to be an important and effective pillar in our national response, enabling the early detection of clusters and community transmission and appropriate measures to limit the exposure. Namibia's testing coverage remains high, with a ratio of 266 persons tested per 100,000 people in the country. Fellow Namibians, the vaccination campaign is making encouraging progress. So far, up to 13.9% fully vaccinated coverage has been recorded in Khomas region, 12.6% in Hardap region, and 11.9% and 11.8% in Erongo and Kavango West regions, respectively. The most vulnerable segments, such as the elderly and persons who have comorbidities, have been vaccinated to a greater extent. However, uptake by healthcare workers remains lower in comparison with only 14.5% fully vaccinated. I just got a message from a person I respect, Dr. Libertine Amazila, and she is appealing to Namibians to be vaccinated. Please, you know how she can talk. Please tell them to be vaccinated. And I am now telling you that Dr. Libertine Amazila is asking, begging maybe, that we must be vaccinated. During the period, we recorded an average vaccine uptake rate of 3,556 doses per day. National vaccination coverage currently stands at 15.1% of population for those who have received their first dose, while 9% of the population today are fully vaccinated, only 9%. This is a long shot from the requisite 60% total population coverage target to achieve herd immunity by March 2022. I implore all eligible Namibians to come forward and get vaccinated. Please, I implore all eligible Namibians to come forward and get vaccinated. Vaccination remains one of the effective measures in our national response to avert serious illness and death from COVID-19. When the government developed the National COVID Vaccination and Deployment Plan earlier this year, we adopted the principle of voluntary vaccination. We adopted the principle of voluntary vaccination. The aim of that approach was to encourage vaccine uptake on voluntary basis. Of recent, there has been broad discussion on different platforms about mandatory vaccination. It has also been reported that some employees are making it a requirement for their employees to get vaccinated. This does not change the position adopted by government so far. As such, to date, vaccination in Namibia remains voluntary. But it's your life. It's voluntary. I said again, why must we beg you to save your own life? Why? It's voluntary, but please be vaccinated. It must be emphasized that COVID-19 is evolving, and the measures to combat it effectively must, as a matter of necessity, also evolve to be robust and dynamic. In this regard, government is considering available options on how to protect our people. In this regard, government is considering available options on how to protect our people to overcome COVID-19 as a public health threat and return our country to normalcy. Discussions in this regard have commenced, and the nation will be informed accordingly. I express sincere gratitude for the solidarity demonstrated by the Republic of Serbia, who donated 15,000 doses of component of 1 to 2 of the Sputnik vaccine. The private sector, Namibians, and development partners alike continue to render immense support and contributions, including the augmentation of the public health facilities and support with COVID-19 vaccines that have been received in the country through bilateral and multilateral approaches. Fellow Namibians, the nation will recall that 2 weeks ago, certain amendments were made to the COVID-19 public health regulations in order to relax restrictions related to the sales of alcohol, the operations of certain businesses, and the duration of PCR test results to enter Namibia. These amendments, which were gazetted on 6 September 2021, came about following consultations and engagements of stakeholders in government, the private sector, and business associations. We trust that the amended measures will facilitate business operations and thereby support our quest to safeguard lives while supporting livelihoods. During consultations with the business associations, undertakings were made that business owners would put certain measures in place to minimize risk and help prevent the spread of new COVID infections. This includes the provision of sanitizing and hand-washing stations at shippings and bars, limitations to the number of players at gambling machines to one person at a time, prevention of overcrowding in shippings and bars, as well as the promotion of vaccination amongst patrons at bars and shippings. It has unfortunately been observed that the measures agreed to have not been wholly implemented. We call upon our business people, those in the north who petitioned the government, to hold their end of the bargain and put the agreed measures in place. Fellow Namibians, the current COVID-19 public health regulations will expire at midnight tomorrow, that is Wednesday, 15 September 2021. Having reviewed the current COVID-19 public health measures, the following regulations will come into force for a period of 30 days from Thursday, 16 September 2021 until midnight, Friday, 15 October 2021. 1. Public gatherings. As defined in the regulations have been adjusted to 150 persons per event. The number of spectators at sporting events is permitted up to 150 spectators per event. 2. Curfew. Curfew will be extended to begin from 23, that's 11 p.m. to 4 a.m. daily, so that people who are taking the last one must prepare, and they got extra hour. And by 10:30 around, nobody must be served so that they can get ready to hit the road. No one for the road. Last one is finished 10:30. Finish. 3. Restrictions related to liquor were relaxed midway during the current dispensation to facilitate increased business activity. The measures related to the sale of liquor remain as per amendment of 6 September 2021, and that is, this means, A, where the seller is a holder of an off-sale license, sales may take place from 9 a.m. until 22 hours, Monday to Friday, and from 9 a.m. until 13 hours on Saturdays. B, where the seller is a holder of an on-consumption license, such as bars, shebeens, casinos, gambling, and betting houses, the sale of alcohol may take place from 9 a.m. until 22 hours, Monday to Saturday. No sale of alcohol on Sunday and public holidays. C, where the seller is a holder of an on-consumption license, such as hotels, restaurants, and accommodation establishment, the sale of liquor served with meals is permitted from 9 a.m. until 22 hours, Sunday to Sunday. There you can eat and drink, Sunday to Sunday. 4, burials. Burials of persons who succumbed to COVID-19 or whose deaths are COVID-19 related must continue to take place within a period of 10 days, and all meals must continue to be served on take-away basis. The restrictions on the number of persons attending public gatherings kept at 150 persons per gathering applies to mourners only, and that excludes essential workers. Mourners only. Fellow Namibians, a wise man once said, and I quote, "Habit is a powerful means of advancement, and the habit of eternal vigilance and diligence rarely fails to bring a substantial reward." I like this thing. Let me quote. A habit is a powerful means of advancement, and the habit of eternal vigilance and diligence rarely fails to bring a substantial reward, unquote. For us to continue to advance in our war against COVID-19, we must maintain the habit of eternal vigilance and diligence. Let us be wary of caution fatigue and not fall into a false sense of security. It is true that as the pandemic wears on, many of us are eager to return back to the lives we enjoyed before the onset of COVID-19. I'm aware that many people are relaxing their safety practices and returning to old routines. However, to let down our guards at this juncture will prove costly. COVID-19 still poses a considerable risk, and we need to look around the world at nations that were praised for their efforts to fight the virus, only to witness an explosion in infections over the past several weeks. Let us make sure that that is not the case in Namibia. This has been a war of attrition. We have faced some cold and dark months. We have lost so many brothers and sisters along the way, but we are closer to seeing the light at the end of the tunnel. It has not been easy, yet collectively as a nation, united in purpose and galvanized by our spirit of patriotism, we have continued to move forward. Let us maintain our efforts. Let us remain committed and remain resourceful in order to emerge from this difficult chapter in our nation's history and continue to build our Namibian house, one brick at a time. I will now call on the following ministers to bring in their inputs, Minister of Health and Social Services, Minister of Justice, and the Attorney General to elaborate on some technical issues. Minister of Health.
Thank you very much, Your Excellency the President, for giving me the floor. Your Excellency Dr. Nangolo Mbumba, Right Honorable Prime Minister, Honorable Ministers and Deputy Ministers, ladies and gentlemen. Thank you, Comrade President, for giving me the floor to share with the nation additional information on our national COVID-19 preparedness and response. The COVID-19 pandemic remains a public health threat of international concern and a wide national, economic, social, and of wide national, economic, social, and cultural ramifications. Its effects have been and are being felt around the globe, albeit at varying degrees. It is, however, a source of relief and encouragement that we are starting to understand more and more about the pandemic. This is helping us to adjust our response strategies in confronting the pandemic in a more effective manner, allowing us to protect lives while also preserving livelihoods. I draw the attention of the nation to the latest global COVID-19 statistics and also the situation here in the country. I believe that such information will help our nation to appreciate more the challenges that we face as a country, an appreciation that we hope will help to engender the kind of social and behavioral changes that is required to turn the tide of this pandemic and its impact on our country. As of yesterday, the 13th of September, the global statistics for COVID-19 were as follows. The number of positive cases have reached 225,550,017, with 202,158,427 recoveries. Those who died as a result of COVID-19, the number stands at 4,645,629, representing a 2.1% case fatality ratio. His Excellency have already informed you about the national statistics. The President addressed the concern around vaccination in his statement. I wish to add that of concern is the fact that the number of people being vaccinated with the first dose in Namibia are less than those of persons who are coming for the second dose. It is important to note that persons who have received the first dose have built up immunity against COVID-19 and are therefore afforded a level of protection. Those who are not vaccinated are the most at risk of severe illness and death. We are seeing this in our daily statistics, as the great majority of persons who are currently hospitalized are those that have not been vaccinated. Similarly, the COVID-19 deaths recorded in the country in the past 3 weeks are almost exclusively of persons who have not been vaccinated. Let us do what is right and get vaccinated. There have been allegations in social media that people who are dying are those who have been vaccinated. There is no shred of evidence that supports this narrative. On the contrary, statistics confirm that those who have died are not vaccinated. We informed the public about this in our daily reports. Namibia continues to increase the availability of and accessibility to vaccines to its population in order to boost our vaccination campaign. During the past month, Namibia received the following vaccine doses. Now I will catalog those doses that have been donated. We have received 75,000 doses of AstraZeneca from the Netherlands on the 8th of August 2021. Further, we have received 20,000 doses of Sinopharm from the Republic of Zimbabwe on the 31st of August 2021. We have also received 15,000 doses of Sputnik 5, that is component 1, from the government of the Republic of Serbia on the 2nd of September 2021. The delivery of component 2 of the Sputnik vaccine from Serbia is still awaited. We are expected to receive the following donations of vaccines: 318,720 doses of AstraZeneca from the Federal Republic of Germany, 100,620 doses of Pfizer from the United States of America, 30,000 Vax from the United Arab Emirates. The government has bought the following doses: 40,800 doses of AstraZeneca vaccines, which were procured through the COVAX facility, and these were received on the 10th of September 2021. These doses are the remainder of the 108,000 doses which government bought earlier. Further, 108 doses of Johnson & Johnson vaccine from the Africa Vaccine Acquisition Task Team will arrive today, the 14th of September 2021, at 13 hours and 20 minutes. And again, 350,000 doses of Sinopharm vaccines procured from the manufacturer, and the date when they will be received will be communicated. At present, Namibia has sufficient doses of the vaccines for the vaccination campaign. We therefore urge our people to get vaccinated. There is a false information being circulated alleging that Namibia has received expired vaccines. I want to debunk these lies and state categorically here that there is absolutely no truth in such allegations. The nation must remain assured that all the vaccines delivered to Namibia, whether through donations or those that we have procured with government resources, are within their shelf life and are safe for use. Members of the public should stand warned that spreading false information about COVID-19 is an offense. As such, anyone who spread false information about COVID-19 will face the full wrath of the law. We are continuing to strengthen our capacity to monitor the epidemiology of COVID-19 pandemic on a regular basis. In this regard, we have expanded the COVID-19 testing capacity nationally, comprising state-owned and private sector laboratories. Currently, Namibia has the third highest COVID-19 testing capacity per 100,000 population on the African continent, behind South Africa and Gabon. Gabon is in the first place. We now have 2 laboratories with the capacity to conduct genome sequencing, namely the University of Namibia and the Namibia Institute of Pathology. Genome sequencing is an important tool in our national COVID-19 response and preparedness, as it allows us to identify the COVID-19 variants circulating in the country so that we may target our response appropriately. On previous briefings, I have informed the public of the project that we have completed earlier. In order to further increase the number of isolation beds to cater for COVID-19 patients, new projects comprising prefabricated isolation units were completed between June 2020 and September 2021. The capacity of this facility that were recently completed ranged between 4 and 12 beds. They were constructed at places such as Windhoek Central Hospital, 24 beds, Walvis Bay Hospital, 24 beds, Opuo Hospital, 4 beds, Shakati Hospital, 4 beds, and Nana Hospital, 12 beds, Okongo Hospital, 8 beds, Rundo Hospital, 8 beds, Katima Mulida Hospital, 12 beds, Kobabis Hospital, 8 beds, Bariental Hospital, 12 beds, and Keetmanshoop Hospital, 12 beds. Similar projects are currently underway at Okahao, 12 beds, Andara, 12 beds, Oshivarongo, 12 beds, Okahanja, 12 beds, and Karasberg, 8 beds. They are expected to be completed and commissioned soon. The former Kotatura Hospital TB ward is also being extended to cater for an additional 96 COVID-19 beds. The evaluation of the bids is ongoing to recommend a contractor for this project. Furthermore, the government has funded the repurposing of a unit within Keetmanshoop Hospital to create 15-bed intensive care units. The facility is due for commissioning soon. Similarly, a unit within Katima Muliro State Hospital will be converted into a 14-bed ICU. The procurement process for the repurposing of the said facility is underway. Other district hospitals around the country also have limited capacity to provide for ICU. We have taken a conscious decision to capacitate district hospitals to be able to provide for the appropriate ICU services. The identified hospitals to be provided with ICU capacity are Utapi in Umsati, Shivarongo in Ochodonjupa, Rondo in Kavango East, Kobabis in Omaheke, Mariental in Hardap, Ngela in Ohangwena, Opua in Kunene, and Nankudu in Kavango West. The ICU capacity at this hospital will range from 10 to 15 beds per hospital. It should be noted that pre-COVID situation, the number of ICU beds countrywide was severely limited. The creation of additional ICU capacity will go a long way towards the realization of our objectives of further strengthening services in area of surgery, obstetrics, and anesthesia. I reiterate that Namibia, and indeed all persons within our border, should take personal responsibilities to combat the spread of COVID-19. The disease does not spread by itself. It is spread by persons as we move around and when we do not comply with the public health regulations. Let us therefore continue to do what we know to be right. Let us conduct ourselves and behave in such a manner that we will not experience another devastating wave. The current respite teaches us that it is possible to bring the number of new infections down. Let us now hold hands and work together to prevent new infections. I thank you.
Thank you. Next. Whoever has, yes.
Thank you very much, Your Excellency. All protocol observed. Your Excellency, you have set out the measures that are in place to address some of the measures and the concerns that we have in responding to the reduction of cases, but also to ensure that we don't get back into a space that we were a couple of months ago. I just want to reiterate a few things, Your Excellency. The first one is the question around public gatherings. I think we all understand that there are public gatherings that are prohibited. Those that are prohibited means that you have to only have 150 people there, excluding service providers. And I'll come to service providers in a minute. I want to focus a little bit on the fines that are associated with breaching some of these particular measures. So, for example, if you have more than 150 people at a funeral, at a party, at a wedding, it will be required, a number of things will happen. You will still be required to, for example, ensure that people wear their masks when they are not eating or drinking. For example, you will still be required to ensure that there is sufficient distance among the patrons at that particular event. So when you are setting up a table, you must consider that there is at least 1.5 meters between the people that are sitting around that table. I think when we are in that space, when people are gathering for longer periods, they often forget to maintain those health protocols. Now, in the event that you are found to have exceeded that number, for instance, when the police or law enforcement comes to a particular event, normally what the police would do is they would educate the public about the importance of maintaining those public health measures, but also they will give them the opportunity in the event that there are people, when they're not eating or drinking, not wearing masks, they will be given an opportunity, for instance, to put on their mask. They will be asked, for instance, to keep a certain distance at that particular time. When you refuse, though, to comply with those lawful instructions, there are fines that are attached to it. The Namibian police have the authority to give you what we consider to be a fine. Now, how the fine works, Your Excellency, is that you would be given a piece of paper, the same way that you'd get it when you violate a traffic regulation. So what the police would do is they would give you a paper. There will be two things on that piece of paper. There will be a date for a court hearing, but there will also be a fine. If you refuse, for example, to comply or disperse a public gathering, the police can give you a fine of 6,000 Namibian dollars. If you agree in that instance, for instance, that you are guilty, you can go to a police station to pay that particular fine. So there's no payment. There's never been an arrangement where the police take cash on the spot, but they can give you what we call an admission of guilt fine. So it's important for people to understand. If you breach that, you'll be charged 6,000 Namibian dollars, or you can go to court and defend yourselves. Something that we, in respect of the curfew is from 23 hours till 04 hours. There are only 3 instances on which, when you are found on the street beyond the curfew time. In other words, if you are on the street 1 minute after 23 hours, the police can give you a fine of 4,000 Namibian dollars, or you can get an opportunity to go and present your case in court when that time comes. If, for example, you say, I am an essential service worker, but you don't have proof or a certificate that says you're an essential service worker and you are beyond the curfew time, you will be charged a fine of 2,000 Namibian dollars. When it comes to face shields, Your Excellency, the regulations are very clear. You cannot wear a face shield without a mask. It has to be both. In the event that you're found with only a face shield, you will normally be asked to put your mask on. If you refuse to do that, you are likely to be charged with a 4,000 Namibian dollars fine. It is important for members of the public to understand that the wearing of face masks is one way that we are currently controlling and preventing the further spread of the coronavirus. We do encourage our compatriots to please increase the vaccination numbers. Please, if you're unsure about vaccination issues, the Ministry of Health has very good information available at the moment, frequently asked questions that relate to the reasons why we need to get vaccinated. The other issue, Your Excellency, that has become a little bit of a concern, and I picked this up when I was joining Cosmos Corps on Friday night for about 2-3 hours. We noticed, Your Excellency, that there is still a large contingent of people who go, particularly where I've noticed this is in restaurants and in nightclubs. There is not a lot of people that maintain social distancing where it is possible, particularly when you are not in a group that you're with when you arrive at that place. But also what we find is even when people are not eating and drinking, they are just continuing to chat around the table, they are not wearing their mask. And this is the way the virus continues to be spread. If we want to maintain the number to remain as low as it is at the moment, we really need to improve the manner in which we conduct ourselves in those social settings. And so if you, for example, sell alcohol on a Sunday and the police find you to be selling alcohol on a Sunday, you are likely to be fined 6,000 Namibian dollars. You would have lost all that you made perhaps the previous night by paying that particular fine. So avoid attracting that kind of attention and comply with the regulation. I think there's sufficient relief being given from Monday to Saturday evening, 22 hours, that people can have access to alcohol as they would like it. But please, I think let's try and do our best in maintaining that particular protocol. And it's the same with on-site consumption. If the police find you or law enforcement finds you after 22 hours selling alcohol to your patrons, for example, in a nightclub or in a bar, the police can fine you about 6,000 Namibian dollars. You have an opportunity, of course, where there is a court date indicated to go and defend yourself should you not agree with that arrangement. Just lastly, Your Excellency, there is a very important role that heads of institutions, CEOs of companies, organizers of events, whether it's a sporting event, whether it's a wedding, whether it's a funeral, there's an important role that those particular individuals play in maintaining and controlling the further spread of the virus. And when the police or law enforcement finds that at a particular site there is no compliance with the rules, there is a fine that is attached to that organizer or instigator having the responsibility to pay that fine. Normally, the police or law enforcement would give you an opportunity to rectify. Your Excellency, I must say, when I had gone around with city police, I noticed that they take a lot of time educating members of the public. They go into these communities and have discussions about what is going on and why it's important that people maintain the health protocol. So it is not that law enforcement simply goes in, disperses people, and so there's actually a conversation that happens before they would enforce some of the regulations. The last thing, Your Excellency, that I want to say is that it is considered that for us to make sure that there is no further spread of the virus, the requirement of the rules currently is that clubs, for example, or bars, even restaurants must maintain half capacity. So you must ensure that your space is able to still maintain the kind of distance that is required of 1.5 meters. So please do not cram people into a small space saying that we were told that we can now have 150 people. If your space, if your environment cannot accommodate 150 people, what we are encouraging you to do is to maintain half capacity. And you can encourage your patrons, actually, when they have visited enough in that particular environment, maybe even every 2 hours, to make sure that there are new people coming in. So there is a manner in which we can manage this without necessarily losing out on livelihoods. Finally, Your Excellency, I do just want to say that The question around service providers is an important one, and I know that sometimes this can be used as a loophole to have more people in a gathering than it is required. When we talk about service providers, we are talking about people who are coming to give a service to another person. If, for example, at a funeral, you are a choir, what we are encouraging you to do is, as the choir, you finish your singing and you leave the space so that there is enough space, particularly for the mourners, to remain in that particular environment. So let's please not use the service provider as an opportunity to increase the number of people at public gatherings. Thank you very much, Your Excellency.
So that as long, I think we'll move on. Others who are sitting there will be the ones to answer first questions. That way I can engage them, including the Vice President and Prime Minister. Questions?
Thank you.
Is, I think, briefing.
Yes, please. Thank you so much. My name is Kevin. I am a reporter for Eagle FM. Thank you so much, Honorable President, for coming out on the issue of mandatory vaccinations, because that is the topic right now in the streets of social media. But we want clarity. The position of government is that vaccinations are not mandatory right now, but government has taken note of private sector companies that are requiring mandatory vaccination where it pertains to application for jobs. Where you haven't come out clear, Your Excellency, is to say, as a stakeholder, does government encourage this that we are observing in the private sector, what we are interpreting as de facto mandatory or corporate-sponsored mandatory vaccinations? Do you encourage that? Do you discourage that? Because there is a strong feeling that this is likely going to have constitutional implications where it infringes the rights of people, most importantly, where it pertains to access to resources, as well as the equality to have access to opportunities. And that is the clarity that we want from you, Mr. President. Thank you so much for that.
Thank you very much, Lawyer. Attorney General, answer that. We'll come in to have. I want everybody to be involved. You have to skip it. You don't have to answer it. Okay. Now I can go ahead.
Thank you. Thank you very much, Your Excellency. Your Excellency, I think this point has been clearly explained in your statement, and I think all of us need to understand that the reason why we are talking about possibilities of considering other measures to encourage vaccination is because the uptake is still low. Obviously, if there was a strong will from the public to voluntarily, go for vaccination, these issues or this question shall not arise. Obviously, I think one need to also take note of the fact that in terms of the law, of course, the Constitution allows as fundamental freedoms that we enjoy as people. However, those freedoms are also subject to certain restrictions that are reasonable in terms of the law. And those restrictions must be necessary within a democratic society like ours. So now, when you look at the situation that we have at hand currently, we look at where we are dealing with a pandemic that is not only affecting the rights of individuals, but also where individuals are posing risks to others. One now has to ask, what is it that we want to address? Of course, one has to take note of individual rights, but also have to take into account public interest. And if, to some extent, individuals are posing dangers or risk to others, then government shall be required to look into those options. Now, if you look at the labor law of this country, there are certain provisions that actually imposes obligations on the employers to provide a safe and healthy environment not only to their employees, but also to others, for example, members of the public, and to their customers. Similarly, those provisions also impose obligations on employees to protect themselves against any health risk and also to protect others who are affected by their activities at the workplace. Now, coming to the issue as to what the real position is, I think clearly, currently, vaccination is voluntary at this stage. However, it has been said, looking at where we are now, we are looking at various other measures to encourage the uptake of vaccination. As for companies that are making certain requirements for voluntary vaccination, obviously, one has to look at what are the motives for this. And if it is found that some of these requirements are reasonable and necessary within the circumstances, then they might be found not to be unconstitutional. So I think there could be good grounds for doing so, in order to minimize or prevent the risk of infection. However, I think we also need to acknowledge that whatever the situation in terms of the rights of individuals, there are also certain restrictions that can be imposed to manage, also to prevent the infection to others. So those measures, they can be tested against the law, and there are certain provisions in the law that could be used to justify that. But obviously, the position as it is now, as far as government is concerned, is voluntary. But as for other institutions, they could use those measures that can be tested against the law. Thank you.
Very good. Common good. We have individual rights guaranteed in the Constitution. But your right stops. Individual right will stop where the other person's right also starts. So we all have rights. But also duties too. One has rights, but you must have obligations. We're talking about a war. People are dying. It's not a joke. We see it, we bury them every day. So if I'm saying, take care of yourself, protect your family, protect yourself, protect the nation, and you are talking, I have a right to go around and kill myself, if you come to my establishment, I will stop you, because I have also right there. And then common good of the nation is with us, who are elected. We can declare war, isn't it, as a president? Then they don't take it to the parliament. So to save land, their lives, we are begging, we are trying to appeal. I have been doing that now for, I don't know, for how long now. Now, are we going to fight on technicalities about the rights I have? When we are dealing with a serious enemy, indivisible enemy, it's not a threat. It's the truth, people are dying. It's not a joke. We cannot have a technical point scoring kind of a thing. We must all hold hands and say it's a serious matter. We must all tackle where we can. Yes, next. We can continue with the question and then you can come in. Oh, yeah.
Good morning. My name is Shaligan Peterson. I'm a journalist with the Namibian. President, this question goes to you. Can you just elaborate more on your vaccination? May we know what vaccine you got and how you procured it? To the Minister of Health, about your vaccination, which vaccine you got. You're not going to...
I don't know how it feels.
I'm sure the Minister and the Presidency could assist.
Yeah, maybe, yes.
Dr. Shangula, I will keep asking you this question about the fourth wave. Government wants an open festive season. We're not seeing the number of first doses administered increase. Just this week, you said that there has been a decline in first doses administered. Are we preparing for the fourth wave? Not that we're hoping we will have one. ED, can you just tell us how much of the 500 million for the vaccines, or the money that was set aside for the vaccines, have been used so far? And then this one will perhaps also go to perhaps the ICT minister or the Minister of Health. We've seen, as I said earlier, the first doses administered have decreased, and the Minister of Health has also said that. What are we doing to sort of encourage people again? We saw sort of people just rush to the vaccination sites when we saw the third wave, but now we're seeing a sort of slowdown and decrease in people going for the first doses. What are we doing to increase the vaccine take-up? Are we perhaps thinking about incentives in any way, working with private companies to encourage people to take the vaccine? And then for the Deputy Minister of Education, we've received some complaints from teachers saying that they have proof from the doctors that they are a health risk in terms of COVID-19. They shouldn't be working, especially those who are pregnant and have underlying health issues. However, despite them showing this proof to the principal or the head of their department, they still get a no that they should continue working. Has your office received any complaints about that? And how many teachers perhaps are not at school because they have underlying health issues, or they are pregnant and they pose a bigger risk to COVID-19? Thank you very much.
Thank you. Can we start? You got the order. I already commented on mine. Minister, yes? Minister's there. Oh, here.
The question regarding what we are doing to encourage people to come for vaccination, you would probably recall that I have been on the vaccination campaign over the past weeks. I've been to 7 regions in our country, and the Deputy Minister will be visiting the rest of the 7 regions. We have talked to the stakeholders, community leaders. We have distributed materials. But you know, as the saying goes, we can bring the horse to the well to drink, but we cannot force the horse to drink. This is what the President told you, that we are telling people, go for vaccination. But it is your life. We cannot force you. But what we are saying is that we cannot allow you to put at risk the health of other people. We are on a vaccination campaign. Thank you.
Very good. So you ask more questions. Education?
Thank
There was
you
a
very
question
much.
to ED too. You will come next, huh?
Thank you very much, Your Excellency. On the underlying condition of our staff, I can start with the teachers who are pregnant. Even in the time where there's no COVID, we have rules in place already how to go about it. And the other issue where we have COVID conditions, we are dealing with that one. So, but at this stage, I can say we didn't get any complaints from a principal where they are forcing teachers to go on, or forcing teachers who are having underlying condition to come and work. And I want to make use of this opportunity really to thank our principals, management of our schools for the cooperation we got in this fight against COVID. Thank you.
ED.
Thank you very much, Excellency, and thank you for the question. As it was stated by the Honorable Minister, we are obtaining vaccines, both through donations and those that we are procuring. There are resources coming from both the state coffers and with the support of the private sector, for example, through the Vaccines for Hope coalition. Certain resources are also being used because some of the donations that we are getting, we may, for example, be obliged to pay for transport and such matters. But the information is available in terms of what has been spent so far. It is being collated, and it will definitely be communicated to the public. But as we have it at this point, the procurement processes are ongoing. Some are finalized, some are not finalized. So it will be too premature at this point to give you an exact figure of how much money we have actually spent so far. I thank you very much.
Then we go to the next question. Is something was answered? You're not, you have to answer. Okay, I'm sorry. Still an answer. There's still a question. Answer.
Yeah, I'm still answering the remaining question from Shelley Gunn. The question was whether, in view of the low number of first clients for vaccination, are we preparing for another wave? What we are doing currently is that we are doing some mathematical modeling to predict the possible occurrence of another wave. That's number one. Number two, as the Minister of Information and Communications Technology has mentioned, that we are actually increasing the campaign. We are on the campaign to increase the vaccination uptake so that people go for the vaccination and get protected so that we do not find ourselves in a similar situation we came out. And thirdly, in my statement, I have explained the project we are undertaking in the event that calamity fell upon us as well. Thank you.
Okay, you can continue now with the questions.
Good afternoon. My name is Bahia Thiririka from the New Era. Dr. Shangula mentioned the issue of misinformation, and this is something that has been widely discussed. I would like to find out from the Justice Department, do we have a list of Namibians who have been either held liable or arrested for spreading false information about COVID?
Thank you very much for the question. We don't have any record of people that have been arrested or held liable for the spreading of false information. It's been extremely difficult, particularly in the environment of social media, to pinpoint exactly the origin of a particular source of information that has been spread. What we have tried to do is to take a flexible approach to the interpretation of false information, because you can imagine when we go to court, there are a number of key elements we have to comply with to show intention, for example, to show unlawfulness of the information that has been spread, and the kind of anti-vaccination or COVID misinformation that we have seen. It has made it extremely difficult, but it's certainly something that we have between the Office of the Attorney General, my office, and the security cluster that we've been thinking about how to handle it, but it's certainly not an easy feat to handle. Thank you.
Continue. Otherwise, I will close. Madam, no question today. I'm not. From the same. but they normally, both of them, ask. Anyway, are you through? Can the Vice President close it? Can I work on the work?
Thank you very much, Your Excellency. I just want to say a few words. First, to thank all our church, traditional, and political leadership who have emphasized that we need to be vaccinated for the benefit of our whole country, our own health, the health of our families, and our co-workers wherever we are working. There has been some other people thinking that they have the rights to do certain things. And I want to use an extreme example. Some of us farm, and while I'm trying to prepare myself to go to my farm on Friday, the president is calling me for consultation or for instructions. I have a knife in my bag, I have a knife on my shoulder. Will you allow me to be carrying weapons of any kind, no matter how small, even knives, to enter State House? That's a risk we cannot afford to take. Why should somebody who is working with other people, who is living in the same family with other people, be allowed with the potential to carry this virus, bring it home, bring it to work, and is his freedom? But that freedom can lead us all to get sick, to need hospitalization, and maybe even lose our lives. So let us be reasonable. There is a nice verse which is quoted in the Bible, which is quoted by many people. Say, where God did not give us the spirit of fear, but of power, love. But there is another one that say, the last words say, of sound mind. Of sound mind. It is unreasonable to expect others to take care of their lives and to take care of their health, but for you to do whatever you are doing. So, Comrade President, I think we should, my last point will be on the issue of why are we worried about the fourth wave when we have the possibility to control the third wave, and if we control it so well, then the issue of the fourth wave will be smaller, will not come as a surprise. So let us do what needs to be done now, so that in the future we have the freedom to do other things. Thank you very much, Mr. President.
I didn't know you were versed in Bible so good, so thank you very much on that note. Thank you.